This segment of DelmarvaLife is sponsored by TidalHealth.
Well, you know, healthcare is a hot topic, one that I think is safe to say we all have opinions on. Now it's time to have your voice heard on the subject.
TidalHealth, along with Somerset County and Wycomico County Health Departments, is calling on community members to share their thoughts and priorities in a brief survey. It's part of the Community Health Needs Assessment process. Here to tell us more about that very thing, Kat Rogers. Thank you so much for joining us. Okay, so explain to me what a Community Health Needs Assessment is.
Well, it's kind of like a checkup or to see how the community's feeling, seeing what's working, what's not working, all in terms of health.
Okay.
Oh, okay.
Yeah.
So why is it so important to do this assessment?
Well, it helps us determine what resources, what programs, what areas we need to focus on. So for example, we do this every 3 years and we prioritize the needs. So our last one helped us see that access was an issue. So where do we need to have providers and services, right, as far as locations, chronic disease and wellness. So what can we do to make screening more accessible for people and preventative care? And then behavioral health. So how can we expand behavioral health services? So those are the kinds of things that come about in the health needs assessment.
Okay, so you want to reach out, you want community members to come talk to you. How do they access that assessment? How do they take part?
They can visit our website, TidalHealth. We have a section and we'll put the link out there. But their voices are so important because people understand what the issues are in their neighborhood, right, how they feel, what the issues they're facing, their families, their neighbors, and our data is only as good as what we get in. So this really is a chance for people to be heard. It's a really brief survey, and then later on in January, mid-January, we'll also have focus groups. So people who want to actually talk to us in an hour-long session will have the opportunity to do that as well.
Okay, so you gather all the information from the surveys and the focus groups, then what happens?
We compile all of that and then we compare it to what secondary data. So looking at the statistics in the public health reports and the hospital data, along with what our community members have told us the issues are. We combine all of that, and then that's how we determine the priorities and where we need to focus our efforts.
Now, this isn't the first time you've gotten community input. So are there programs and initiatives and such that have started because of this kind of input?
Oh yes, absolutely. So I mentioned behavioral health,
right,
being something that regularly comes up. You've heard of the Crisis Stabilization Center.
Yes.
So identifying that a need, sort of like an urgent care for mental health, came about by understanding the needs and barriers to mental health services. So that's a great example of a program that came about because of the needs assessment.
Okay.
And then the Wagner Wellness van is another one?
Yes. So using the data, we could see where there were areas of people with limited access, and so that helped us decide where we needed to take the Wagner Wellness van for screenings.
Okay.
Now, one of the things that you said when you first came in and we were sitting down talking before we got started was you are really excited over this. Why?
I'm really excited just because I'm passionate about community health. I used to actually teach the course about community health needs assessment at SU.
Okay.
So just geeking out a little bit about needs assessment, but because I believe in the importance of data, but in bringing that with what people are experiencing,
right,
and then working with partners outside of healthcare to meet those needs, because it's not just about the medical care, it's about transportation, housing, food, all of these other factors and social issues and environmental issues, and working across multiple sectors to address those needs.
Yeah.
All right. Very interesting.
Wow, yeah.
So make sure that you help out with that survey. Kat Rogers with TidalHealth, thank you so much for coming in, and hope your holidays are great.
Yes.
Thank you.